general curve. I'm presenting it this morning before I present our county level epi curve or epidemiologic curve. So what we're trying to do with all the efforts I'm talking about every single time is our team here at the Board of Health and our colleagues at the Cleveland Department of Health and our surrounding health departments are working really hard to contact trace, identify every case, isolate those cases as quickly as possible, identify their contacts, and then quarantine their contacts to reduce that curve, to flatten that curve. That's in conjunction with what you've seen from our governor and our state health director, critically important measures to keep us all home. Any interaction is a potential exposure to this infection. So we've all got to do everything we're being asked to do as individuals and collectively as a community to flatten this curve. Because the dotted line that you see there is health system capacity. And if we crest over that dotted line, our healthcare providers will not have adequate resources to get everyone the high quality medical care to save their lives that we are accustomed to in this community. So this is what we're trying to avoid. We are trying to hold back the floodgates so that we never get to that surge capacity line, that dotted line that means we don't have enough resources to give everyone the critical care they need. Next slide. So each Friday I will present to you our epi curve. You've seen some state epi curves, and my goal here, our goal here as a team, is that we give you local data that then helps you to understand how, as a local community, we are, what does our local data look like in comparison to the state and then nationally? Our efforts are at the local level. We are trying really hard. We're following the Ohio Department of Health and the governor's playbook. So Dr. Acton and Governor DeWine guide what we're doing. We are in complete step with them. We're doing everything that they are recommending we do. But at the community level is where the action happens to flatten the curve on contact tracing and isolation and quarantine. So that's why it's really important for people to understand our approach and what our data look like. So what you're going to see is that this will continue to evolve. You'll see that there is a lag from our symptom onset all the way through to the testing, but that's because we didn't have testing available. The blue lines, and again, this will be on our website, you can, the public, anybody can download this and look at it. The confirmed illness onset is a lag for many cases from when we had the specimen collection, because that was a product of when testing became available in our community. You'll also know that we've begun adding recovered cases onto this epi curve because we also want you to see the success of these public health interventions, which is getting people through this infection, and hopefully then they have immunity, and then we'll begin to build immunity as a community. Our antibodies, our immune systems are beginning to respond to this. So you'll see that evolve as well. The big spikes of the testing do coincide with a significant number of tests that were done around some drive-through testing, which was just publicly reported, but some of that is still lagging in. The test results are coming in. So this will continue to evolve, and that's why I think our team has decided we as a team would like to present this on Fridays. So it'll give you, if we present it more often than that, it's going to be hard to make sense of what's happening, but if we present it in each week, then you can see how things are evolving by week, and you can also see how that compares with our state as well. Next slide, please. I'm also today going to talk to you about some data our team has decided would be very helpful. We have to make decisions about what data would be the best to tell the story, and we want to give you as much as we possibly can. So I'm going to give you a few pieces today that we as a team feel would be helpful for you to understand the scope of this infection in our community, but this will continue to evolve as well. And if we have other data that becomes available to us that we feel would be helpful to tell the story, we certainly would. We've been talking a lot about percent positivity, meaning how many COVID tests are actually done here in our community and how many of those are positive. That's a really, while it might seem like not a hard number to obtain, it's actually kind of hard because we have 4 hospitals doing internal testing, but we also have private labs doing testing, and we also have residents of our community who have had tests done in labs in other states. And so we've been tracking down all of this information, and we aggregated it, meaning we put it all together so we could give you a percent positive today to the best of our ability. And so we found that when putting all of the tests that we know have been done for COVID in our community, so that's Cleveland and Cuyahoga County, we have a 5% positive in our community to date. That is going to continue to change, and I'd like to make sure people know that our testing is highly focused on hospitalized patients. So if we had been testing broadly across the community, which we don't have the ability to do right now, it would look different because those people may have some other circulating virus and they're not positive. And influenza's been very high in our community. So we've seen a lot of influenza. Early in the drive-thrus, we were seeing about 20-ish% influenza on those swabs. Those swabs never went on to be tested for COVID because those people had influenza instead. So as we see influenza begin to wane, and our influenza report is available to you today as well. I'm not going to talk about it in the interest of time, but you can also take a look at how those data are changing. You'll see this percent positive probably change. But this is our best estimate for today, and I will continue to update this as I can. We're grateful to our hospital partners for sharing as much information as they can about their negative tests, which I previously have documented to all of you are not available to us through the state system at this time because of the volume of testing. I also want to share with you that the percent of COVID-19 lab-confirmed cases in our community, 29% of those have been hospitalized. That is, they've been hospitalized overnight in a hospital, not just an emergency department visit. This is, they've been admitted to the hospital either on a medical unit or in the ICU. We have had 12% of our cases total have an ICU admission or intensive care unit admission, meaning they needed higher levels of care. I will tell you from stories of my colleagues on the front lines in the hospitals and in the intensive care units, they are managing people on the floor that might at some time, have been in a usual situation, needed intensive care. Sometimes we make judgments about whether someone should have a higher level of nursing care based on, our concerns they might decompensate. But right now, we're having people in the ICU who are very, very sick, and we're managing people on floors who have oxygen requirements and they're battling COVID but don't need to be intubated or be on a ventilator at this time. We also have 26% of our COVID-19 infections in this community are among healthcare workers to date, and this again will continue to change. This is people who work in any form of healthcare. So these are individuals who may work in hospitals, emergency departments, ambulatory clinics, long-term care facilities, other folks who may have any job that's related to healthcare. We call that emergency medical services, firefighters, first responders. That they're all included in this, not law enforcement, but our first responders on the medical side are. And the last bit of information we'd like to share with you in conjunction with our hospital partners, individual hospitals and our Center for Health Affairs Regional Hospital Association, we're all working together, we're all on the phone on a regular basis, multiple times a day. We'd like you to understand the county level utilization. This is just another piece of information that lets you understand how much capacity we have to care for people who are sick from this and how that will change over time. So at the county level, currently we are at 64% of utilization, meaning we have people in the hospital, 64% of 100% capacity. Remember, I gave you that dotted line a few slides ago. That would explain when we're at 100%. We never want to get to 100%. We want to stay below that. So we're at 64 on the medical surgical. Those are people who don't need intensive care. For pediatric medical surgical, we're at 37% utilization. So we have a lot of availability across our community. For critical care adult, we're at 65% utilization. And for ventilators across our community, we're at 36%. So this is encouraging to us, but if we don't flatten the curve, these numbers will be quite high going forward. And so it's critically important that people don't take this information and say, we've got plenty of capacity, we can get out there in the community. We need you to stay home unless you absolutely need to do essential business. We need you to isolate yourself at home if you're sick. We need you to quarantine if we've asked you to quarantine unless you have to report to work because you're a healthcare worker and your organization has asked you to come in. We need you to please listen to this advice. It is not a suggestion. We need you to do it, or we are going to have problems with our hospital capacity. Okay, that's the end of the slides. Okay, I'll give you a moment to pivot back and get Heather again. Oh, you know what? Oh, shoot. I'm sorry. We had one more. Was it on there?
One more.
Yeah, I apologize. I'm so sorry. There's one more. You all can punch me in the arm from a distance on the way out. I am so sorry.
Don't punch her in the arm, please.
Just give me an air punch on the way out. Sorry about that. Kevin, can you please give me the map? Sorry to all those viewers out there. We don't mean to give you whiplash with the cameras changing. But I have to say, it's a remarkable sight in here with all the cameras socially distancing and pivoting in this very beautiful move here. Okay, the other thing that we'd like to present to you today, thank you, Terry, for reminding me. I don't know how I skipped over that. This is a map. This is a map of cases by zip code for the entire community. And again, this will be on our website as soon as this press conference is over. And again, every Friday we will continue to give you updated maps. What this does is show you the frequency of cases by zip code across our county. And we're working closely with our Cleveland Department of Health colleagues who also have been working on mapping and also obviously on contact tracing. So closely together, we're trying to make sure that we collectively give you the most helpful information, and we thought a map might be helpful today. What the big takeaway from this map is that all of this, the entire community is affected. We have cases across our entire community, and this map is going to continue to evolve, and we will continue to have more cases. So please understand, this was run, and since this has been run, I can tell you we've had more cases. This is a very recent run, and we've still had more cases since this. So we'll continue to update you, but just recognize that if you see this frequency of infections, everywhere you go in our community, there is COVID-19. So you should expect that you have the potential to be exposed if you are out and about. This is precisely why we're asking you to stay home, unless you absolutely need to. That's the end of the slides. I'll wait until you guys give me the thumbs up across the room. Heather, you okay? Okay. All right, so in conclusion, I'd like to again end by asking folks to be kind to one another. You've heard me talk about some stories. You heard Terry talk about stories. I personally the investigation team in these unfortunate circumstances to hear intimate details of their lives about how this is affecting them. And I can tell you that it is really heartbreaking in many cases. And so I just want you to know that there ever was a time for us to be kind to one another and to really be intentional about loving one another. It's now. And that could be a stranger, it could be a friend, it could be family, but please take that as something that you can do from home while you're staying home. I also want to thank the countless people, some of whom I don't even know who you are, but thank you for emailing us, texting us, calling in to say thank you. Our team, those are the things that keep our team going. All of us, including our media partners, are working long hours, and those little nuggets of encouragement are really what keep us going in the tough moments. And so thank you for that. We really appreciate it. And we try to respond to everyone we can, but I know we've missed some folks, so I just want to say thank you for that, and keep it coming if you can, because it really means a lot to us. We're in this together. We're absolutely in this together. We're in this together, Ohio. As you've seen the hashtag, we're in this together. Northeast Ohio, this is not just about Cuyahoga County. Of course, our regional partners are critically important pieces of this, and we're in this together, Cuyahoga County. And so I want to just thank you all for listening, thank you all for reporting on this, and thank you all for partnering with us as we try to tackle this and flatten the curve as quickly as we can. I will step away and we can take questions as needed.
Thank you, Dr. Gullett. I want to close on something. So what you see, I'm not going to ask you to pivot to the screen, but that is our family here at the Cuyahoga County Board of Health. I've been here for 30 years, and it's been my singular pleasure to work with an incredible, dedicated group of folks. And Dr. Gullett has expanded that family by including the additional workers that are helping to support our response. And they are example public servants. They are committed public servants, and it's been my honor to work with them. I also want to say before we take questions, that it also has been my honor to serve for many years now, I think 7 years, as a co-chair of the Ryan White Planning Council. For what we do there is we manage across the Northeast region and provide support system care for a range of social services for over 3,000 people living with HIV and AIDS. And so what we know, the cautionary tale, as we hear from Planning Council members, are issues around stigmatization that they still face today for HIV, that they describe to us and they still face today, that are incredibly unfair, are incredibly unwarranted, and that in the same vein, the stigmatization that we fear relative to folks who may think someone's positive or hear that their neighbor's positive and begin treating people horribly, that cannot happen in this moment in this community. It cannot happen. And so we ask all of you to take a step back, and this is where your better angels need to emerge. And this is where the best parts of our character as a community need to emerge. And I ask you all, and call on you all to bring that forward and let what it means to be a Clevelander and how we take care of each other shine through. With that, County Executive Budish and Dr. Gullett and I can take some questions.
With the $1 million contribution or allocation for PPE, how much equipment do you expect to be able to purchase with that money?
As much as we can get. And the prices vary depending on the equipment and depending on the time. Matt, do you recall how many we've ordered already and we haven't gotten close to finishing our $1 million?
The big number of the N95s, 100,000 N95s, so at various prices, but that was the big quantity.
And we've ordered over 100,000 masks, and so we're able to buy quite a bit of equipment with that amount of money. It's nowhere near enough. That's why we're still asking for donations. We desperately need donations, and it's not easy to find the PPEs. I could make it $20 million, but if you can't find it, you can't buy it. So this past week, I've probably spent hours and hours on the phone with my counterparts around the country, county executives and commissioners, asking for help, for leads. Where do you know where you can get some of this stuff? And we've been tracking down leads from all over, anywhere we can find. And some of the leads end up with nothing. Some of the leads don't have any equipment right now, may in the future. Some of the leads are charging way too much. But some of the leads have been productive. So we're following every lead we can. If anybody out there sees this and knows where we might be able to purchase more equipment, we're happy to pursue those.
And is that going to be just dedicated for first responders, or does it end up in hospitals, nursing homes?
Everywhere. We'll see how the needs evolve, but when you're looking at the national news, it seems everybody needs the protective equipment. Hospitals, nurses, first responders. I mean, across the board, there's just not enough.
If I may, Armin. So on that vein, I do want to say something. This echoes a theme that you're hearing today, is we're trying to buy ourselves some time. We're trying to buy ourselves some time. Flattening the curve means that we're not seeing this huge increase, the big red curve that we saw, which I think China experienced that during their cases in great display across the world that we all watched. By flattening the curve, we're extending out that peak, potentially from mid-April into perhaps mid-May. That means we're staying below that dotted line threshold for the healthcare system. By extending out cases and keeping them at a lower level over time, we allow time for the supply chain that Executive Budish mentioned to help to come back as we're supplying PPE across the country, to be able to continue to fortify first responders, different types of care facilities, hospitals with the personal protective equipment that they want, that they're trying to get access to. So we're allowing that recovery time to then continue the care, stay under the thresholds that Dr. Gullett showed around bed capacity, around ventilator access. This is all part of the plan, and so you staying home I saw something on social media from one of my boys that said, it's your opportunity now to lay on the couch and actually help to save this community. I think we're up to the task. So that's, of course, works with my young boys who are home from college and are about to begin their classes remotely. So I would just ask you to take that to heart.
Dr. Gall, can you talk about the situations in the community where you guys are seeing the most kind of clusters of spread so that people can understand, is that among healthcare workers? Is that at long-term care facilities? Is that within families or workplaces? I know that privacy is really important, but just kind of knowing the situations in which the infection is spreading might help people understand.
Sure. I'll repeat that question in a minute. I just wanted to finish up on Scott's question really quick. So we have put together, you heard me on Wednesday, think our county and our city and county emergency operations center teams are working so hard together, and our emergency management teams, our EMA team, working really hard together, and they put together a really beautiful plan for collection of the donations as well as our strategic national stockpile shipment, and then put together a very thoughtful, appropriate, data-driven approach to ensuring that PPE distribution is getting to where it needs to be. And so many people in this room were part of that, and the county executive team, staff, but also I just want to acknowledge that there's a very thoughtful and intentional approach to that to ensure that places where we identify PPE needs that might not be first, the hospitals are clearly an issue, right? But that we have a lot of other people in communities that are getting care in other places, and so we really walked through that. And there's and that's all coordinated at the county EOC and by the EMA team. So I just wanted to acknowledge them again for that, and to make sure that the public knows that this is a very intentional process. So Rachel's question was about, could I please talk a little bit about the community clusters that we're seeing? And you've heard me talk about a multi-pronged approach here at the County Board of Health in conjunction with our Cleveland colleagues around our community's response at the local level, and part of that was a cluster investigation response. So when you identify cases, you begin to then learn about their lives and where they've been, and that's why they're so, it's such a privilege and something we take very, very seriously, that they're sharing these details of their lives for the greater good, so that we can track down anybody who might be at risk for the infection. And in that process, you begin to identify what are called potential clusters, meaning people that they've been in contact with who may have become symptomatic, or maybe they're sick themselves at the hospital and they've already been tested themselves. And so our disease investigation team tracks down all of those. This is a truly investigation. And so whenever we identify those clusters, we go in every which direction, and we have doctors assigned to be leads for each of those that we identify. And there are many of them, and we've been doing this for weeks, actually, since our very first cases were identified. And so sometimes those lead us to places that where business led us to businesses where people get essential services. They've led us to skilled facilities in long-term care. They've led us to educational locations. They've led us to homes. We have some large families who've been very impacted by this, and so it's our duty to ensure we are able to help them isolate all safely and have what they need. This is why we have a resource team working with EOC and EMA, who I just mentioned, to get people groceries and cleaning supplies and thermometers and those things, so they're not going, and insulin. People's telling us, I need my insulin at the pharmacy, so we send a staff member out to go pick it up and drop it off at their house. These are the kind of things that emerge with clusters. And so I've given you a couple examples without giving you identifying information, and our disease team then determines when we need to sample. We don't have enough testing to sample everyone who may be symptomatic from a cluster. So we try to be very thoughtful about very limited testing we have, and we sample when appropriate in those situations, so that we can identify when there might be any other potential cluster risk that extends beyond what we know about. So that's our approach. We've been doing this. I can tell you there are dozens that we've investigated and dozens that we're in actively following, and we have not stopped following any clusters or any cases that we have identified. Even those who have been cleared of infection and discontinued from isolation remain on our tracking list, because we've committed that we're with individuals, the community, and any clusters, any affected organizations for as long as this takes.
Those numbers include hospitals, right? It's not just county residents versus city residents?
Which numbers are you talking about?
Like the percent positive?
Right, so when I presented the very first slide that I presented, so Scott's question is what numbers do those include, what I presented earlier. The very first slide I presented were our Cuyahoga County jurisdiction numbers. That's the Cuyahoga County except for City of Cleveland, because our colleagues are separately reporting on their own numbers there. But we are working together to give the information we can to the community to give the best picture, and we feel like it makes sense to have the combined jurisdictions for those epi curves that I showed you and the map. And so the numbers I gave you on percent of our infections that are of hospitalized patients, ICU patients, and healthcare workers is for the entire county inclusive of the City of Cleveland.